Welcome back to Houston Life. May is Stroke Awareness Month, and today we're having an important conversation that could make all the difference to someone suffering a stroke.
Yeah, stroke is the nation's 5th leading cause of death and is a leading cause of adult disability, so getting the right treatment as quickly as possible is critical. Joining us now to help understand the signs and know what to do in the event of a stroke is Tressa Sumners, stroke coordinator at Memorial Hermann Memorial City, and Sandra Small, stroke coordinator at Memorial Hermann Sugarland. Welcome, ladies. We're glad you're here to have this very important conversation. And Tressa, there are actually 2 different types of stroke. Is that true?
There is. There are 2 different types of stroke. The first one we commonly see the most is an ischemic stroke, which is where you have a blood clot that blocks a blood vessel in the brain that causes a lack of blood flow. And then that is what causes the damage to the brain, where we start to have symptoms from a stroke. And the other one we see is a hemorrhage, where there is bleeding in the brain. This happens less frequently, but it still is one of the common causes, or one of the common things of stroke.
Yeah, and both situations obviously could be detrimental. Sandra, what are the factors that are increasing your probability of having a stroke? Is it genetic? Is it environmental? How are we looking at this?
So there are many things that can cause a stroke, but mostly it's good to know that the underlying risk factors that people have can often be managed and well controlled, and most strokes are actually preventable. So there's a lot you can do yourself to manage your comorbidities. If you have things such as diabetes or high blood sugar, things like high cholesterol, high blood pressure, all of those things can lead to having strokes over time. And so if you exercise, try to have a good diet, get the rest you need, and again, manage any comorbidities or family history that you have, it really makes a huge difference in terms of your probability of actually having one.
I also see illegal drugs, diet, obesity, smoking, high cholesterol. So anything you can do to get healthier and remove some of those risk factors can help prevent a stroke. Let's talk a little bit about acting fast when it comes to either type of stroke, right? No matter what your situation, getting attention immediately is a critical key, right, Sandra?
Absolutely. So we always want anybody who sees any of those signs and symptoms in a family member or in themselves to really act as quickly as possible by alerting the emergency response system. So that's to call 911. If you do that, it helps pre-alert the hospital, and we'll get the ball rolling so that everything will flow smoothly and get you into the hospital and get that treatment as quickly as possible.
Okay, and Tressa, we're looking at Be Fast on the screen right now. This is how you spot some of the warning signs, right? Can you take us through these?
Yes, so we like to use the acronym Be Fast. It's easy, people can remember it. There's magnets, we can put them on fridges. But it starts with B, which we look at balance. So does somebody have a sudden onset of dizziness? Can they not balance or stand anymore? Some people may get up to walk and they fall, or maybe they're running into a wall. E is for your eyes. Have we had a sudden onset of double vision, blurry vision, maybe even blindness or being unable to see? F is your classic face. I think most people know this one, is half of your face drooping? What does that look like? But also for face, we can also look at a headache. Do you have the sudden onset of the worst headache of your life? This is more typical of strokes that have the bleeding in the brain. And then arms, do we have weakness on one side? So ask someone to raise their arms, does one fall? They may also have numbness or tingling on one side versus the other. Speech, also another one that a lot of people think of. Is someone's speech slurred? Are they maybe not even able to talk to you? Maybe they're not making sense. And then T is for time. So if we see any of these symptoms in anybody, the biggest thing we can do is to call 911 and you tell them we think that we have someone that is having a stroke.
Wow. I mean, and that acronym, we cannot stress enough just how important that is. And it can happen in an instant, right? You could be out to dinner, you could be at home with a loved one, you could be with a stranger at a work meeting. So it's critical that those around you are also aware of this acronym. Let's talk a little bit about some of the treatment options available. So I didn't realize Memorial Hermann is the first network of accredited stroke centers in the region. And so when it comes to therapy, you want to go to the best of the best. What kind of treatment options are there?
So if you come in within a certain window of the first onset symptoms of your stroke, we can give you a drug called tenecteplase, also called the clot buster. That's what a lot of people recognize it as. And that can help break up the clot and restore blood flow. So you might come in with symptoms and you might be able to walk out of the hospital like nothing happened. And in that time, we can help identify everything that's going on so that we can correct those issues. We also do something called thrombectomy, which is where we're able to go in through, like they would for if you had a heart attack, and take out a blockage in the heart. We can actually go into your brain and take out a blockage in the brain and restore blood flow. And that it's one of the most amazing things I've ever seen, to see patients who can't do anything to then being able to do something.
Well, ladies, it's important information, so thank you for coming. And as stroke coordinators, you both are so critical, right, in this process for all the people that are going in that kind of need your help with this. And your mom, Sandra, was, you were drawn to neurology because of your mom, is that right? You want to tell us a little bit about that?
Yes, well, unfortunately, we discovered that she had a brain tumor when I was in nursing school.
Wow.
And so, you know, that's really what pulled me into that whole area of neuroscience. But ever since then, it's been incredible, because you know, you really get to help people and improve patient outcomes in neurology and neurosurgery as well.
Your mom, how's she doing today?
She's excellent. She's back to herself.
Good.
And
Okay, that's the
honored
news
as
we
ever.
wanted to
That's
hear.
the update we want.
Sandra Small, Trista Sumners, thank you so much for stopping by for this
Thank
very
you so
important combo.
Thank you so much for
thank
having
you
us.
for having us.
Yeah, come back and see us anytime. In the meantime, Memorial Hermann does have a network of accredited stroke centers all across Houston. To learn more about stroke, you can visit memorialhermann.org/stroke or call 713-704-7100.